My name is Diarmaid Crean. I'm the Digital Deputy Director for Public Health England. The project in itself was about trying to help individuals in London who wouldn't naturally come forward if they had a mental health issue and look for help. They were like blokes like me, 47, who would never want to think that because they haven't slept properly in 3 years, that this was something they should go and speak to the GP with. They would just suffer in silence and end up making themselves worse and worse and worse over a period of time. So we were asked, as digital experts, to come in and try to advise a way to help these types of people. I think the way that the agencies involved in Fresh Egg's work in this context was they were able to kind of unpack it and make it seem like a sensible, simple thing, using the experience that you had of building customer journeys and knowing where people are on those journeys. Where are they aware, where they're not aware, when do they become, and right the way through to when they become an advocate. Using that kind of commercial explanation actually made it a little bit more tangible, made it more understandable for people. And I think once we started doing the research and then coordinating the data sets from Pulsar and Facebook or Brandwatch and Twitter and all the other sources of data, also the search engine data from Google and so on, when Fresh Egg were able to kind of bring that together and present the numbers that we were seeing and showing how we could effectively find those numbers of people and target them really, really effectively and cheaply, that's when the scales fell from people's eyes and they could see the massive potential of this. If we hadn't been able to get somebody involved in it who understood what that digital really is data, that's the trick. A lot of people misunderstand what digital is. As I mentioned, your website, is it a website, is it an email, is it an app? All these things are kind of people's simple concept of what digital is. When you become more sophisticated, and when you're a sophisticated digital operator like Fresh Egg have been in this project, you know that it's not about any of the assets, it's about the data and how you use that data. The assets become very secondary to that. So without that understanding, this project, as many digital projects do, would have had the danger of turning into, let's just build another app, let's build another website, let's start an emails project, let's make a brand, and all those kind of concepts that are kind of classical ways of doing marketing and kind of targeting. Once you are able to get an understanding of that, this is an extremely flexible, fluid thing that picks data from where it needs to come from, then you've got a place to operate. And Fresh Egg were able to daisy chain data sources of their own, but also data sources through agencies that they have worked with before from social listening and other areas, and make that power of data come together to make this thing a success. The challenge has really been, could we bring together the amazingly powerful disparate data sets that sit across the digital landscape and use those to deliver micro-targeting, but to deliver personalised public health at scale. That's the true challenge. And the work that Fresh Egg were able to help on this project was definitely that we've been able to succeed in doing that.